To record a child examination for sepsis risk, you'll see a link to child examination on the paediatric consultation template. So here I have a test patient who is 2 years old, and by clicking on the doctor's bag icon underneath the patient's name, you'll be taken to the paediatric consultation template. And here you can access the child examination template. You have fields to record the temperature, the heart rate, capillary refill time, respiratory rate and oxygen sats, and you also have a free text area to record any other examination notes. The thresholds for the different risk categories are here in the grey shaded area, and when filling in the values, the matching risk factor will highlight in bold. So here I'm going to add a temperature of 36.5, a heart rate of 120, and a capillary refill time of 2 seconds. And you can see that the matching risk categories have highlighted in bold. I can then tick to say that they're in the low range, that there's no nasal flaring, and normal response. And record there's a low risk of sepsis, along with the fact that I've given advice and safety net given. If any findings are in the moderate to high or high risk categories, I can record them here, and I also have the guidance on when it's appropriate to send to emergency care. You also have a link to all of the NICE guidance in the bottom corner. In an adult record, you'll find a link to the sepsis risk on the general consultation template. So here I have an adult test patient, and if I click the doctor's bag underneath the name and address, I'll be taken to the general consultation template, and here I can access sepsis risk. And this tool works much in the same way as the child examination, where I can enter the examination findings here. And the matching risk category will highlight in bold. I can then tick to say that everything's in the normal range, there's normal behaviour and a normal immune system, that there's a low risk of sepsis, and advice and safety net has been given. If there are any moderate to high or high risk factors, I can record them here. And I also have the guidance on when it's appropriate to send to emergency care, along with a link to the NICE guidelines.